Today's VETgirl podcast is sponsored by Antech. As a veterinary professional, you deserve a choice. Now you have it with Antech. Experience North America's largest reference laboratory network, comprehensive in-house analyzers and solutions, the most trusted diagnostic imaging equipment, advanced telemedicine and AI-powered solutions, and the flexibility to practice medicine your way. The right diagnostics at the right time. All from Antech. Hi, VETgirl here today with fellow criticalist, Dr. Jimmy Barr. Super excited to talk to him. And today we're going to be talking about all things diagnostic imaging. You guys know Dr. Jimmy Barr. He's the Chief Medical Officer at Mars Science and Diagnostics in Antech. And Jimmy and I go way back. So first of all, Dr. Barr, thank you so much for joining us for today's VETgirl podcast.
Always fun to hang out with you, Justine.
I love it. So before we begin, do you mind just giving us a little bit of background about who you are, where you trained, your journey through your veterinary career, and what you do now?
Yeah, sure. So Jimmy Barr, I'm a fellow criticalist. It's really been, I've had the pleasure of sort of being in a bunch of different roles kind of throughout my career. I'm from Louisiana originally, went to LSU, go Tigers, and eventually ended up, after a stint in private practice, doing my residency at Angel. And so it's something that we have in common there. Have proud alumni there, was, in private specialty practice for a while practicing, and then was at at Texas A&M on faculty there for a bunch of years, and then moved into leadership. And so I've been doing that first with Blue Pearl, and I served as their chief medical officer for about 6 years. And now I sit in this seat. And so it's great to kind of get this particular view of the industry. So it's a lot of fun.
Awesome. It's so crazy how small the vet world is. You probably don't know, but I'm a huge LSU football fan. I've met Mike in the past. Go Tigers.
Yeah.
Had the awesome experience of going to an LSU versus Auburn football game over a decade ago. And it still tops my top 3 sports events in life. So, and
That's
then,
awesome.
Having to survive Angel back in 97, 98 when it was really, really hard. It's still hard, but great hospital. All right.
Yeah, exactly.
Well, last month I got to speak with you and Dr. Michelle Evison from Antech, but we didn't get to talk about one topic I wanted to discuss, and that's diagnostic imaging. Mm-hmm. Whether or not you're in specialty practice, emergency practice, general practice, shelter medicine, everyone is taking radiographs, right? Yeah. So I wanted to dive into the role of diagnostic imaging and how it has an effect in everyday practice, and how innovation in the space can help us as veterinarians, our veterinary teams, and help us provide the best possible care for our patients. Now, everyone has heard, everyone knows, and I'm sure you're going to see this if you go to any upcoming huge conferences, but AI is the new biggest thing out there. And, we talked about how this is not artificial insemination, but artificial intelligence. And last time we were able to briefly talk about AI in day-to-day practice. I wanted to ask you, what realistic applications does artificial intelligence have now in veterinary medicine, and where can we expect it to go in the future?
Yeah, it's a fantastic question. And I'm going to caveat this of saying that I'm going to approach this conversation as a emergency and critical care specialist, right? So my view is of that world. And so I'm going to use examples probably that are going to sort of illustrate that, and so no shade to any of the other specialties. But I think diagnostic imaging is exceptionally important in our world, right? So we rely on that a lot to make decisions for our patients. And I think, when we think about innovation and radiographs have been around for a long time. The fundamentals of them, are still the same in the sense that, X-rays are passed through a patient and then we kind of read them, the attenuation on the other side. It's a little more complex. It's computerized now. We can make up for a lot of exposure problems with post radiograph, interpretations. And, so it's a little bit different, but it's fundamentally an older, diagnostic test. But I think the cool thing about it is taking new innovations and applying it to something that we kind of already know. I think people oftentimes get, concerned about artificial intelligence. It's part of our life. Our kids are going to, they're not going to really remember what it's like to not have that as a part of their world. And it's really kind of strange for me to think about, but it's something that is coming. And, radiograph interpretation using artificial intelligence is something it makes a lot of sense, so anything digital can be sort of aided and interpreted. That information can be interpreted with artificial intelligence. And I think we're so early stage in artificial intelligence in diagnostic imaging at this moment. I don't think we can fully comprehend what it's gonna be, based on what it is now, meaning that right now it really sort of asks a series of binary questions. I mean, no matter which, sort of application you use, it asks a series of binary questions like, is there pulmonary edema or is there not? Is there cardiomegaly or is there not? And the algorithms, what you get are only as good at what questions that you're asking and then what data you're using to train the algorithm. And so you can have a bunch of poor inputs and you're going to get poor outputs, right? So, but the cool thing about it is that it's only going to improve over time, for the most part, if the developers of it make a commitment to improving it over time, right? So meaning asking different questions or different things. I think I'm excited about it, meaning that I think there's a lot of possibilities of how it can aid veterinarians in making decisions. And that's the part that I think is the most interesting part. I'm not really into innovation for innovation's sake. I think that it's got to be practical. And, that's the sort of the main focus in which I view these things. That's my lens.
Awesome information. Now, I did want to ask a real question that's on our mind. One of my favorite specialists to work with was the radiologist I used to work with,
Oh, yeah.
Travis. And
Yeah.
we always had a great humorous relationship. I would have a dog in fulminant liver failure from, some horrible hepatotoxicant. And he'd be ultrasounding it, or a dog with, liver enzymes in the thousands. And I'd walk in and be like, let me guess, ultrasound's normal, right? He's like, well, I mean, technically, because the liver always looks normal in those
Yeah.
cases.
Yeah.
So
Mhm.
I've always had a really great relationship with radiologists, but I do want to ask, will
Mm.
AI replace veterinary radiologists?
I mean, in short, in my opinion, no. I mean, I think that, it's the same argument of, you can extend this argument to a bunch of different things. I mean, will artificial intelligence replace veterinarians or anything? And I really don't believe that to be true for the exact reason that you sort of talk about there. Is the beautiful thing about collaborative work in veterinary hospitals is just that. You can work with other humans to create a care package that you just can't replicate that when either you have like singular perspectives on a disease state, or if you're by yourself, you're going to only have your perspective, and you have numerous perspectives on that. It's going to be amazing. I really firmly believe that. Now, I do think that artificial intelligence is going to make us better, in the sense that it's going to make us more efficient. There's going to be times, I mean, we're already seeing efficiencies in artificial intelligence in radiology specifically, in the sense that it makes sure that the radiographs are oriented the right way. So instead of like coming up where they're upside down and backwards, the algorithms can flip them around and make them be oriented in the right way with the head to the upper and the left. And so that kind of thing actually saves time. And so that can make things more efficient. And you think that, that can't be that much time. Well, over a long period of time, that means a radiologist can do a lot more stuff. And so that's the kind of thing I think is helpful. There's so much that humans and the human brain can add, as far as the context, putting it on, especially if you're taking a radiograph and you heard crackles on the right side, you're going to be looking at a left lateral radiograph to make sure to look at that upper aerated lung and look to see if there's, a little something there, which those little intricacies are, that's pretty hard for a computer to replicate. I don't know what the future holds. I'm not like pretending to be a prognostic, person, but I'm just saying that in our lifetime, there's so much that humans add. I just don't think it's going to replace radiologists, because it's just that collaborative ability. It's just amazing.
You brought up a great point with that lone practitioner. And there are so many practitioners that, especially in certain areas where they may be the only veterinarian, they don't have a lifeline where they can ask for a second opinion, right?
Yeah.
So just knowing that we have the option of getting the radiograph interpreted and getting more assistance with that, I think is so, so important. A lot of people don't even think about it, especially as females. We always try to keep our VETgirl podcast PG, but like pap smears, they're read by AI, right?
Yep.
Because they're done all the time. And most people
Yep.
may or may not be aware of that. But again, there have been so many improvements in AI. It's really nice to see that there are new technologies that we can embrace. I always joke that we as veterinarians are very slow to embrace technology. I mean, there are some clinics out there that are still using fax machines. So sometimes we are slow, but we do have to be aware of the new technology that's out there, especially when it can improve our quality of care. Now,
Totally.
how do the new imaging techniques fit into busy practice? You and I have both been at slammed practices where sometimes you're
Yeah.
interpreting radiographs for an intern on the fly when you're running down the
Hmm.
hallway. And how do the more traditional modalities integrate, like what we talked about with ultrasound?
Yeah, totally. I mean, this artificial intelligence is only a slide. It's only a tool. It's only a piece of the information that you're going to need in order to make decisions. And I think that, it will aid you in making decisions. I think it's a good cognitive aid. It kind of helps with our ability, it mitigates some of our biases, and that we have where we might have sustained inattention. That's a psychological term. It's a thing where, when you're doing something else, it's hard for you to focus on some sort of unexpected salient piece of information. Like, does that sound familiar to anyone? I mean, of course, we're doing 100 things, in practice. And so, it will help us, kind of stay focused. And I don't know about you. I mean, I have a ton of things competing for my attention all the time, right? There's, your cell phone's buzzing, you've got, people on the line. Back when I was in practice, there's, lots of folks asking questions about different things, and your attention gets pulled in a bunch of different ways. And, it's been shown that if there's something that you don't expect to kind of pop up on something, you have a high likelihood of missing that when you're focused on other things. And so, from my standpoint, I think that that's really helpful for that. But, honestly, we've still got to acquire the radiographs, and we've got ultrasound at our fingertips, right? I mean, ultrasound's another sort of area that I think, AI is not really a part of that right now, but there probably will be some stuff. But really and truthfully, the image acquisition is probably the most important part of that, right? So you're just sort of looking, and oftentimes, you find something that, you don't expect, and you're like, well, that's something that we need to look into, right? So, I mean, ultrasound's an exceptionally important part. I mean, and especially ultrasound has gotten so much more mainstream. I don't know about you, but like when I was in vet school, they would not let the students touch the ultrasounds. That just wasn't a thing. But, now that's kind of part of the curriculum, and that, that's part of how they're sort of learn about veterinary medicine is kind of through that context. And that to me, I think is ultrasound is part of that. The ultrasounds are getting better, they're getting faster. The computing ability of the ultrasounds themselves to kind of make the images sharper, give us better information. It's continuing to sort of get better. That I think is helpful. CTs are continuing to get faster, more slices, easier for people to use. And so you certainly can't pin your hopes on any one thing and lose context of the others. And, this, from my perspective, and especially when you're talking about AI, it's just really a small part of the clinical picture. You got to pull everything together in order to make the right decisions for your pet.
This sounds terrible, but I'm going to sound like one of those really old veterinarians. I graduated 27 years ago. I learned in a used old ambulatory ultrasound,
Yeah,
like one of the small ones that looks like the original Apple computer that came out.
totally.
And what they
Yeah,
have now is amazing
yeah.
technology from the
I was
portable
just
ones
telling,
to the bedside
yeah,
ones.
I was just telling somebody the other day, I remember holding one of those sector probes where those like kind of rounded in. It was like going back and forth. You could feel it vibrating in your hands. It was terrible. It's terrible. And anymore now, the ultrasounds are so good. And they're just, as long as we don't poke holes in the probe, the covers, like then they're going to give us pretty good information.
Exactly. And you heard it from this VETgirl podcast. If you learn one thing, please do not, when you're doing cystos, poke the very expensive ultrasound probe with that darn needle. Okay. It
Thank you.
ruins a
Yeah,
probe, and the probe's the most expensive part.
that's
All
right.
right.
That's right.
Well, in January of 2025, we launched our VETgirl Antech Diagnostic Imaging Certificate, which is 20 hours of race approved CE for both veterinarians and veterinary technicians. And Jimmy, I know you're a huge part of this. I just wanted to give a huge special shout out to Antech for making this complimentary. Most of our certificates are locked to paid subscribers. And I know you're giving one of these webinars. Do you mind talking a little bit about what you're covering? It's obviously a passion topic for both of us as criticalists.
Sure. Yeah. I mean, so I am talking about the dyspneic and coughing cat. All right. And so I'll be working with a radiologist, Dr. Love, that's going to kind of talk about, the clinical and the radiologic, aspects of those cases. And I don't know about you. I found the dyspneic cat to be a really hard clinical entity, right? So when you're trying to approach those cases, you got to always balance like how much do I really want this diagnostic, especially around radiographs, and what does it look like, and how are we going to be able to do that? We're going to go through all of those things, and we're going to kind of take a little bit different of an approach when it comes to, trying to diagnose, the dyspneic and coughing cat. So it's going to be really fun. I'm really looking forward to it because feline medicine doesn't get enough love, and this is going to be a little bit more love for the emergency presentation of a cat.
I will also say most veterinary professionals hate saying dyspneic cats. We're probably the weird unicorns that are like, dyspneic
Yeah,
cat,
maybe.
awesome. I want to tap
Yeah.
that.
Yeah,
Right.
right.
So
Yeah.
excited to do that one. But I was actually truly passionate about this certificate because I always felt like one of the hardest radiographs to interpret that we do every single day in the ER and in general practice is that darn Labrador retriever. Where like,
Yeah.
is
Yeah.
this radiograph
Is it obstruct or
obstructed,
not?
right? To
Yeah,
cut or
I
not to
agree.
cut.
I
So
know.
super important. In full disclosure, I don't touch teeth. I
Oh.
don't even know the order or the numbers of teeth. So that's my poo poo. But we
Yeah.
even have a dental radiograph
Yeah.
webinar coming up, which is really important because I know everybody has that in general practice now, from, diagnostic essentials for the vomiting dog to ortho ones, right? Ortho
Yeah.
ones are super hard. Osteoarthritis versus osteosarcoma. Like, how do you tell? To
Hmm.
talking about dysplasia, elbow dysplasia to hip dysplasia. So again, what you're doing with the dyspneic cat, looking at pulmonary patterns for dogs. I definitely
Hmm.
want to check it out because it's so much amazing content, and one I was really passionate about because every single area of veterinary medicine, whether or not you're a large animal or, exotics or general practice or specialty or whatever, everyone takes radiographs. So really, really important.
Yeah.
Is there anything else in our diagnostic imaging certificate course material that you're excited about as a critic list?
Yeah, so I'm going to bring up a kind of an unsexy one, but it's something that's really interesting, and I think it's going to be helpful for the profession in general. But the ones about hand-free radiology, so like that one is going to be really interesting because I think we've got this idea, we've always done it this way, and so it's hard to imagine us not doing it that way. But you don't actually have to be in the room whenever you take radiographs. We all don't want to see fingers in the films, right? That's not good for anyone.
Never, never.
Especially, yeah,
The
yeah.
radiologist will scream at you.
Goodness, like that's something that folks hate. And it's not great for for people. It's not the safest thing to do, and it's not necessarily safest for the animals either. And you can get really good films if you get practiced at kind of changing your workflow a little bit. And they'll talk about all of that stuff.
Just say yes to drugs. Just say yes
That's
to
right.
more sedation.
Better living
Exactly.
through chemistry. Yeah.
Exactly. It's really interesting because I recently had to get a bunch of diagnostic imaging for myself personally. And if you haven't read about it, you can check out my hepatopathy blog that was posted a month or two ago. But as I was getting my radiographs, I was joking with the diagnostic imaging nurse and I said, "You guys have it so easy." When he was like, "Turn to
Yeah.
the right, hold still, take a breath." I was
Yeah.
like, "You guys have it so easy." Right? In
Totally.
veterinary medicine,
Totally. And
it's
you
so
you
much
probably
harder.
didn't even have a Will Bite sticker on your chart or anything
Exactly.
like
Well,
that.
actually, I
Yeah.
did. I did,
Okay.
Jimmy.
Yeah.
Just kidding. But, this is also a shout out to our amazing veterinary technicians and veterinary assistants who help take radiographs every single day. It's so important as a diagnostic tool. It's a lot of work. So definitely want to tune in for that one of what we can do to keep everyone safe, make imaging easier and better for the pet. Now, what excites you about the upcoming year in imaging? And, give me the heads up. Are any new developments or offerings from Antech coming out that we need to be aware of?
Yeah, you mentioned one that's very, very exciting. That's going to be around dental radiology. It's going to actually be good at sort of helping, to try to determine does that tooth need to be extracted or not, that kind of stuff. And so there's a whole new aspect of it of rapid read that's going to kind of be focused on dental radiographs. But I think the thing that excites me the most, and I guess if I just were to think about, rapid read, for instance, right? It's not that new features are going to be added, which is great. It's going to improve all the time, right? That's the cool thing about it, right? It's being trained as it's being used, right? So it's going to be, radiologists are looking through those films to kind of see, making sure that they agree with the interpretation of that. And that's a really cool thing from my perspective, because like what it is now is not going to be what it is in the future. So it's going to even sort of learn better. And from my perspective, I think that sort of commitment to, continuing to teach the model is really, really helpful because, the information that it's able to use is only as good as the accuracy of it. And in my view, a radiologist is still the gold standard. It's going to continue to be for a long time. And that for me is really cool. And so, from that perspective, I think, I'm most excited about what does the future look like in the next year, 5 years, that kind of stuff. I think it's going to be, it's hard for us to even imagine. I can't even imagine the way it is now. I mean, this algorithm was trained on 16 million radiographs. I can't even fathom how much that is. And so, other things that are kind of around, I think, are continued. I hope, as we sort of progress as a profession, that we'll continue to have radiologists review our films. I don't know, Justine. I mean, what do you think the proportion of radiographs that are taken in practice now are interpreted by a radiologist? Like, what's your ballpark figure?
Great question. I would say in specialty clinics, a significant amount are because they usually
Yep,
have a radiologist on staff. So they have to read
completely
all of
agree.
them. In general practice, I'm going to say a small percentage because of the cost and the time, right?
Yep,
So it's hard, but there are definitely ones that are sent out because they're more complex. Like, again,
sure.
classic example, it's a greyhound. Is it severe osteoarthritis or is it osteosarcoma, right?
Right.
You always want a
Yep,
radiologist to look at that.
yep,
And again, that's why I always say like a radiologist is my go-to right-hand specialist
yep.
because it's great to be able to walk down the hall and be like, WT, what's up with these
Yeah.
radiographs,
Yeah. Hey,
right?
what's going
And
on
get the
here? Yeah.
answer
What do you think? Yeah. I
exactly.
mean, and I love that. I mean, I agree with you. I think especially clinics are much more likely to have them, interpreted. But I think there's probably places where it's like 10% of the films, I mean, there's an enormous amount of films right now that there's probably things that good medicine's being done, but there's, there may be things, missed on the edge of the radiograph that you weren't paying attention to that a radiologist would look at. And so from my perspective, I think we just need to keep marching on towards better medicine, improving, that kind of stuff. That's what excites me, that every day, every year is an opportunity to get better.
Veterinary medicine has improved so much. You haven't lived until you dipped radiographs old school style in a
Big
dark
time.
room, right? I
That
mean,
smell of vinegar just still like brings me back.
exactly.
Yeah.
I
Yeah.
used to do that as a veterinary assistant. And, it is amazing because there are times when, I don't know, an animal will fall on the x-ray table. And, you and I are old enough to remember doing barium series where like you have to catch it so quickly, where
Yeah.
you can take a lot of radiographs with digital, or you have the option to tweak them as needed. So, I mean,
Yeah.
just even the progression from old school, dipping
Yeah.
film, old school style to having digital radiography is so
Yeah.
amazing.
Yeah, yeah. I saw a television show that was a little bit older the other day that had a view box, like in a veterinary hospital, had a
That's
view
great.
box like on the wall. And I was like, boy, you don't see that all the time anymore, So it's things have improved and they'll continue to improve. I mean, imagine what's it going to be 20 years from now? That's the thing that I think is really interesting to think about. What are the things that now we take for granted when, 20 years from now, we're going to laugh about, ha ha ha. Remember when we used to use antibiotics, that kind of stuff. I mean, I don't know.
Exactly. So much changes.
Yeah.
Well, Dr. Barr, thank you so much for joining us for today's VETgirl podcast. Awesome information. Again, so appreciative to Antech for sponsoring the diagnostic imaging certificate. Just go to our VETgirl website, click on the upper top where it says certificates, and you can check it out there free. Again, there's one free live interactive webinar per month. There's a bunch of on demand. It closes out December 31st, 2025, which feels like forever ago, but you definitely want to check that out and get 20 hours of free race approved CE. Dr. Barr, thank you so much. Awesome talking to you and look forward to seeing you soon.
Always great to talk to you, Justine. We'll see you soon.
Thank you.